For those of you who just joined us, we're talking to Dr. LPearson, who is the member of the Community Coalition for Minority Health in Tennessee. And we've been talking about various problems dealing with minority health, especially cancer and heart disease. We'd like to continue our conversation, Dr. Pearson, by talking about something that oftentimes is not classified as a disease, but nevertheless, I think in terms of the mortality among black folks, as many people die of it as cancer and some of these other diseases, and that is homicide. Mm-hmm. The recent report on homicide indicated that youngsters between the ages of 15 and 24 generally faced homicide as one of the chief causes for death in the state of Tennessee. And I'd like to talk about that and what can the coalition do in terms of dealing with this question of homicide, especially black-on-black crime. That's essentially what we're talking about.
Mm-hmm. Right now, since that's not one of our areas that we are working with, we haven't really thought about it. However, when I did look at the statistics for homicide, as I was looking at the statistics for the causes of death in the state of Tennessee, you'd be surprised to know that homicide was the highest cause of death among minorities in Tennessee. For every 100 whites who died of homicide in Tennessee, we had 511 males, white males, black males, as compared to 100 white males who died of homicide in the state of Tennessee. For females, we had for every 100 females, white females who died of homicide in Tennessee, we had 319 black females. So there is a problem.
A dramatic difference between the two.
That's correct. But the problem is right now, the Community Coalition for Minority Health is not dealing with this problem. Again, we are dealing with the problem of cardiovascular disease and cancer, with the 4 major risk factors that I mentioned earlier.
The President's panel on cancer was recently in Nashville, was it not?
That's right. It was yesterday, as a matter of fact. We had the President's Cancer Panel that will be visiting 4 major sites in the United States that was here yesterday at Haney. And we were very happy to have had them here. They brought out some very good points on cancer that affect us as minorities. One of which they spoke of barriers that we still have in our community that keep folk from coming forward for clinical trials. They talked about the risk factors that I spoke of, and then there are many others. And it's interesting, the thing that I picked up yesterday was that if blacks suffer from heart disease and they suffer from hypertension and some other of these major chronic diseases, it's difficult for the doctors to help them when they have cancer because it interferes, and the medication and the treatments interfere with all these other diseases that our folk have.
So some people have both diseases, 2 diseases?
They may have both. They may have heart disease and they may have cancer. But when heart disease affects your kidneys, you see, and it affects the liver and some other portions of the body. And so when you're trying to help a person with cancer, maybe giving them chemotherapy or something like this, then that affects what's happening with heart disease.
So it's really a much more complicated problem than it really is.
That's right.
And do you find that black folks are subjected to that problem as a problem much more than the rest of the population?
I think so, because we wait too long before we go to the doctor to find out if we have a problem. Again, we're not preventive-minded. We're crisis-oriented, you see. So we wait too long to go and get help, while blacks do with some diseases, and I might add that prostate cancer is the site that's highest among black males, and breast cancer is not as high as in females, white females, black females as they are in white females, but we die sooner from breast cancer because we have waited too long to go to the doctor.
Now, what about programs that can be designed in order to deal with that question? I know in the question of infant mortality, we've intervened in some instances, and we've dealt with, in many instances, teenage mothers and et cetera, and we've been able, in some instances, to reduce infant mortality just a little bit. What about intervention programs dealing with the question that you're talking about here?
We have intervention programs. We have intervention programs to help people to stop smoking. We have programs to help them to reduce their weight. We have programs to help them reduce their cholesterol or the amount of fat in the diet period. And we also have a program to help them reduce their high blood pressure if they have high blood pressure. So the programs are there, the intervention is there, but we do need the people to come out and take advantage of it. Now, when we had the programs in the churches, we expected 100% of the members to come out. Well, I'm not sure that we can get 100% of members to do anything, but we did expect to have more of the members to come out than we had. We had about 10%, and that was good. But we'd like to see more of the members to come out, to take advantage of the health fairs, to be screened to see where they are, and then to take advantage of the intervention programs.
Is there a possibility, in terms of all that we're trying to do in terms of intervention, is there a possibility that the majority of us are simply afraid to deal with the whole question or the possibilities? That is, we would rather that cancer overtake us, that heart attacks overtake us, than to come out and find out what we could do in terms of intervention and our own well care. Is that a possibility?
Yeah, fear enters in. I've had people, when I've done some surveying or study, to tell me, I don't want to know I have a problem, you know. But we can't hide our heads in the sand. We're going to have to deal with the problem. And the problem is to become responsible for our health. We cannot say, you know, these diseases that we're talking about, cancer and heart disease, especially cancer, you can't really tell that you have cancer or diabetes. You know, these are silent killers, or high blood pressure. They're silent killers. And you can have it and not know it. And so you have to go and be tested to see whether you have either the risk factors or that you have the disease.
Dr. Pearson, during the last couple of minutes that we've got here, as a way of some final comments, what if a person wanted to know more about the community coalition, and how would they get in touch with you or other members to become involved in this? Because I think, after all, that is what we're trying to do, to make folks aware of the problem and then become involved in organizations such as yours. Well,
if they want to become a part of the coalition, a member of the coalition, they can contact the office of the coalition stationed at Meharry. The telephone number is 327-6927. If they want to participate in the program, we are working with a small group of churches right now, but if their church is part of those small groups that I'm working with, then we expect them to come out. If they are not that part, then if they will hold on, we will be there, and we hope that they will take part.
And so there are many, many ways that people can volunteer, can become active.
Yes.
And the most important thing, I would imagine, is that we practice this whole idea of well care, that is to take care of our own.
Take charge of their lives, take charge of their health.
And we find that so many people are not able to do that today, or simply do not wish to do that. Mm-hmm. And they, for the most part, rely upon physicians, and we've got a declining number of physicians. And let me thank you for coming by and giving us this information. I'm almost sure that it will have some impact upon the community. We've dealt with it on many occasions. Mm-hmm. We've talked to people from Meharry dealing with the question. And for the most part, it seems that sometimes it's almost a fruitless kind of task, in the sense that we are saying the same thing over and over again.
Well, I think that we have to say it over and over again until it becomes part of us.
Internalized.
Internalized, and then we can act upon it. You know, our attitudes have a lot to do with our behavior. And so we first got to get the facts